Greetings everyone. I am here to talk about specific learning disorder, SLD, which is one of the neurodevelopmental disorders, and it is covered under our syllabus on understanding abnormal child psychology. So, as we all know, while we are keeping ourselves safe as well as our loved ones safe by staying home, and some of us are trying to in our own way, study, learn, and some of us are even submitting assignments, let us actually try to understand how one who is diagnosed with SLD, a child diagnosed with SLD, how it may be difficult for that child to learn, to memorize, to read, and even to solve sums. So let us see what SLD is all about. So like I mentioned, SLD is a neurodevelopmental disorder which has a biological origin, which means that it is the basis for abnormalities at a cognitive level, also associated with behavioral signs of the disorder. So we have both cognitive and behavioral components here. When talking about the biological origin, we are talking about how the genes interact, or the study of epigenetics, which means how we study the changes in gene activity which are not actually caused by changes in the DNA sequence, and also how these are have interplayed with environmental factors which can affect the brain's ability to perceive or to process verbal or non-verbal information efficiently and accurately. This SLD, it affects learning in individuals who may come to us, who may come to the clinicians as having normal level of IQ, at least an intellectual functioning of an IQ, let's say, which is greater than 70, or 5 points greater than 70, or maybe 5 points lower than that. So people who are not having any intellectual disability in the other years, they used to term as mental retardation, now called intellectual disability. Those who are not in that category, who are supposed to have an adequate level of intellectual functioning, however, still have problems in some areas of their scholastic functioning. Sometimes they are often called as unexpected academic underachievement. Why? Because these people are expected that they will be performing good because they are smart enough. That's what the society feels, that's what their family feels, or their teachers, or even their classmates. However, that's not coming in their progress report cards, that's not coming in those results. So like what is given here, it may even occur in individuals who they even call gifted, who are so talented and who are considered to be very brilliant. This SLD, it cannot be attributed to these external factors such as economic or environmental disadvantages, chronic absenteeism, or even the lack of education. It's not the educational status that matters in the diagnosis of SLD, it's beyond that. Or even some neurological or motor disorders, or even hearing problems, or impairment in vision, which are often associated with problems learning academic skills, but are distinguishable by presence of neurological signs. So we have to make sure that the learning disorder is not of these characteristics. So the learning difficulty that we are talking about in SLD, it may be restricted to one academic skill. Let's say it could be reading, it could be writing, or even calculations, or it could be a mixture of all those. The diagnosis, how will we be able to find out that one is having SLD? So the clinician has to have a very comprehensive assessment. First is they have to take a complete history of the client. So they have to take the medical history, the developmental history, the educational, as well as the family history. So they have to see if there are any genetic abnormalities that can cause this problem as well. History of if there is any learning this difficulty, including the current performance as well as what happened in the past. Also, the impact of the difficulty on academic, occupational, or social functioning. So not just the studies per se, but even how the child is functioning at home or with others. Also, previous or current school reports, portfolios of work requiring academic skills, curriculum-based assessments. So the clinician will get to see all those reports, even the homework, classwork, what the child is doing, because they will actually get to see what errors the child can commit during this problem that they are complaining about. Also, after all, taking all those case histories, IQ tests are administered. So here, they have to see if there is any IQ test that has been conducted. They will see what has happened in the previous score, what is happening currently, using standardized tools. So in India, we often use Mellon's Intelligence Scale for Indian children, MISIC, we call it in short, for assessing first the IQ, and then after that we go on with many other assessments. Specifically, let's say if a child is studying 6th grade and having some learning difficulties, you will assess based on what they are learning in the 6th grade. So you have to assess on various grounds. Could be reading, could be writing, it could be maths or any others, even their general knowledge regarding those. So it's a comprehensive assessment. And this diagnosis cannot be done by a simple person. Let's say it has to be someone who is professional, a mental health professional, and which requires a clinical psychologist. So how do they diagnose SLD? This diagnostic criteria is based on the DSM-5 diagnostic criteria. We're going to talk about the different criteria. The first criterion says that the person will have difficulties learning and using academic skills, and a duration of at least 6 months should occur in this difficulty. So we have 6 symptoms, and out of these 6 symptoms, at least one of them would be exhibited by the child. There would be inaccurate or slow and effortful word reading, difficulty understanding what is being read. So they will not understand the meaning of what is being read. They will just read through, or sometimes they will not be able to read it properly in the way it should be read. And they will have many difficulties in spelling. Also, other difficulties with written expression. Let's say they are going to write about their school. It could be a very simple task for a 3rd grader, but for someone with learning disorder, it will be difficult. Also, even regarding number sense, number facts, or calculations, simple plus minuses for a second, let's say a 2nd grader, they might have learned, but they will not be able to solve those for people having this disorder. Also, in the reasoning part as well, they will face problems. So at least one of these following symptoms are to be exhibited. The second criterion says that the affected academic skills are substantially and quantifiably below those expected for the individual's chronological age. Chronological age meaning the age that, the natural age. So like if you are 8 years of age and your classmates, one is expected to perform normally to perform average. When the child is not able to perform performing substantially low, then this can be thought of. And like I said, it has to be differentiated from intellectual disability. These children have normal or adequate IQ. Also, they can cause significant interference with academic or occupational performance or with activities of daily living. as confirmed by individually administered standardized achievement measures and comprehensive clinical assessment. Criterion C says that the learning difficulties begin during school age years, but may not become fully manifest until the demands for those affected academic skills exceed the individual's limited capacities. So even though those learning difficulties might have been there, they might not be exhibited right away. When the child is actually learning more things with higher studies, then it will show. Criterion D says that the learning difficulties are not better accounted for by intellectual disabilities, like I've mentioned, uncorrected visual or auditory acuity, other mental or neurological disorders, psychosocial adversity, lack of proficiency in the language of academic instruction, or inadequate educational instruction. So, even though we've talked about SLD, SLD comes with different impairments. So one that I hope you've heard of this word called dyslexia. And you might have heard of celebrities who have had problems with dyslexia as children as well. We have Hollywood actors in that list as well. So some people will show problems with accurate or fluent word recognition, poor decoding, and poor spelling abilities. So their word reading might not be accurate enough. The rate of reading or the fluency in reading will not be enough. Like I'm reading fluently, the children might stutter, they might have problems in reading, and even understanding, comprehension will be difficult for children or a person with dyslexia. Next, SLD with impairment in written expression. So, like I gave an example, write an essay about your school. A little child, at least around 4th grade, will be able to write about his or her school. But a child with specific learning disorder is going to have problems there, unfortunately. There will be inaccurate spellings. For grammar Nazis, you will find lots of spelling mistakes, grammar mistakes, punctuation mistakes in the child with SLD. Even how they write and organize their essay will also be sometimes not comprehensible because they have difficulties there. Then, SLD with impairment in mathematics, also called as dyscalculia, the pattern of problems processing numerical information, learning arithmetic facts, and performing accurate or fluent calculations. They will face some pattern of problems there. So like I mentioned, plus minus is simple for someone who doesn't have a learning problem, but for someone who has been diagnosed with SLD, it will be very difficult. Because they don't have a clear number sense, they will not be able to memorize arithmetic facts. Like some of them might have difficulties in even memorizing, let's say, the multiplication table. There might be inaccuracies in their calculations, and their math reasoning might not be accurate. So how prevalent is this disorder? So it says, research says that 5% to 15% among school-age children across different languages and cultures have this SLD. However, in a Mizo society, I don't think we specifically assess their IQs, or especially in these terms, we don't diagnose. So research, there is an area of research in this regard as well. Prevalence in adults. So since there are children who have problems in adults, approximately 4% are still considered to have problems in learning disorder. So how does this develop? There can be language delays or deficits during childhood. They might have difficulties in rhyming or counting, difficulties with fine motor skills required for writing. So this begins before formal schooling, let's say in the preschool years. However, the onset actually starts during the elementary school years, and there will be different behavioral manifestations. Examples are, you might think that the child does not want to learn. The child would be reluctant to learn, obviously, because he or she is not good in learning due to a difficulty that is neurodevelopmental in nature. Then, they might show behavior that is not very obedient to others. Oppositional behavior might be exhibited as well. Some symptoms that are observable are, for preschoolers, you might see them that they don't have interest in playing games with language sounds, like repetition, rhyming. They might not be really interested. They may frequently use baby talk, mispronouncing words. They might even have trouble remembering the names of letters, numbers, or days of the week. Even though people of their age group already have memorized it, they might have troubles there. And they might have failure to recognize letters in their own names. Sometimes B might be called as P when they're already supposed to know those, and have trouble in learning to count as well, at least counting 1 to 10 in preschoolers. Then at the kindergarten level, when they are already taught ABC or AOB, they might be unable to recognize and write letters. They might be unable to write their own names. I'm sure if you can recall, you might have been taught at least how to write your name in the first days of your school. But these children may even use made-up spellings because they're not able to do those. And they might have trouble breaking down spoken words into syllables. Like, it's easy to say a cowboy, but saying cow and boy might be difficult for these children. Also, they may have trouble recognizing rhyming words. There are some children that can be taught. We ask them, what rhymes with bat? Some children will just say cat, but that might not happen with these children, even though they've learned nursery rhymes. So they will have trouble regarding those, and even correcting letters with their sounds. So B might not be pronounced as B, it might be pronounced as something else because they are not connecting how the sound and the letter are coming together. And they might have inability to recognize phonemes. Example, they do not know which in a set of words. Example, dog, man, car starts with the same sound as cat. So they will not understand what phonemes, they recognize the phonemes there. And in primary school, they might continue to have problems recognizing and manipulating phonemes. They may be unable to read common one-syllable words like cat, mat, bat, sat. Those simple one syllables also in primary school, they are supposed to be able to read those. However, it might be difficult for them. They may be unable to recognize common irregularly spelled words, said, to. Reading errors that indicate problems in connecting sounds and letters, and have difficulty sequencing numbers and letters. So if one is in primary school and is asked to write down A to Z, they are supposed to be able to write down those 26 letters in order, or 1 to 20. However, these children might have difficulty even sequencing those numbers and letters as well. Difficulty remembering number facts or arithmetic procedures. In middle school, they may mispronounce or skip parts of multisyllable words. Here comes multisyllables, not just one syllable. So instead of saying animal, eminal, they might call that. Okay, and they may be confused with words that sound alike: tornado, volcano, trouble remembering dates, names, and telephone numbers. Now, I think hardly none of us remember our telephone numbers after saving in our cell phones, but at least we still memorize, I hope, our birthdays. So these children, even after telling them about their birthdays, they might not be able to remember such dates, such important dates, or even names of their classmates. Trouble completing homework or tests on time because it is slow, and sometimes they are exhibited with some behavioral problems, and there might be poor comprehension with or without slow, effortful, and inaccurate reading, and they may have trouble reading small function words like these: that, the, and, in. These might be very simple for all of us, but children, even during middle school, may have problems in these. Poor spelling and poor written work may express fear of reading aloud or even refuse to read aloud in class. During adolescence and even in adulthood, they might exhibit numerous spelling mistakes, and they may read single words and connected text slowly with so much effort, with trouble pronouncing multisyllable words here again. And they may have trouble making inferences from written text and avoid activities that demand reading or arithmetic. So in a group, they might avoid reading or even solving sums. Besides these observable symptoms that I've talked about, there can be other ways of this expression. Like sometimes it comes with episodes of severe anxiety or anxiety disorders, including somatic complaints or panic attacks. These are common across the lifespan and accompany both the circumscribed and the broader expression of learning difficulties. And also, research says that there are even gender-related diagnostic issues here. It is found that SLD is more prevalent, more common in males than in females, and these factors are actually associated, such as ascertainment bias, definitional or measurement variation, the language, the race, or even the socio-economic status. And what can this lead to, these difficulties? Since it's about a difficulty in scholastic performance, this can lead to lower academic attainment, higher rates of high school dropouts, lower rates of higher secondary education if there are dropouts in high school, which can lead to even higher rates of unemployment later if they're not able to learn, and which can lead to psychological distress. And if there is distress, then there can be poorer mental health outcomes. So while we are having, or if we know someone with such problems, these can be addressed at, let's say, during the lower levels, so that they can be helped and intervene during the early stages of life. I'd like to quote what Gordon Smith says. He says that we take our kids for physical vaccinations,